So just like with lower eyelid surgery, there being multiple approaches, same with brow lift. So the two most common approaches that I use for brow lift, one is a lateral or a temporal brow lift. Those are the kind of two names that it most commonly goes by. There's an incision back here in the hairline. It's about 1.5 centimeters posterior to your hairline. It can be up to 2 centimeters in length. And really what it is like a little temple facelift. We're lifting the lateral portion of the brow and this portion of the temple. It pairs really well with facelift surgery because if we're getting a good facelift where we're getting a good vertical lift of that mid-face because we've released all these ligaments, there can sometimes be a little bit of bunching here, so it can really help soften that out and bring that up and out. It's very good isolated alone just to get rid of some of that lateral hooding that you can have in your upper lid, or if you have very heavy upper lids, doing a lateral brow lift can help keep the incision in that natural supratarsal crease by addressing that lateral hooding. Now, the other approach that I use is the endoscopic approach, and I call it the endoscopic approach and not specifically an endoscopic brow lift because I don't use a camera most commonly because I know where the anatomy is really well. But the incisions for that, we make depending on where your hairline is, we mark where that is. We always avoid that. We do little tiny stab incisions, kind of paramedian, that gives us access. And I use endoscopic tools to release all of the tissues here and along here. We still use that lateral brow lift approach and release along here. So all of this tissue is being released, which gives the ability to raise the medial and lateral portion of the brow. So that's very good for patients where this medial portion of the brow has descended down and is sitting below the orbital rim. And so that can really be a nice refresh. It's also the approach that I use when patients are really asymmetric. I may do an endoscopic approach for one side and just a lateral for the other to improve symmetry.